Good morning, everyone. For many of us, when we think of MRIs, we think of the medical bills involved. Well, thankfully, there's a place that offers the highest in quality diagnostic imaging at an affordable cost. It is called American Health Imaging, and here to tell us all about it, our president and CEO, Scott Arant, and Chief Operating Officer, Dan Valentine. Gentlemen, thank you for being here.
Thank you for having us.
I appreciate it. Well, tell us all about American Health Imaging.
So American Health Imaging is an outpatient radiology company specializing in MRI and CT scanning. We do other things, but truthfully, MRI and CT is what we do best and in all of our facilities throughout Metro Atlanta.
So you're non-hospital outpatient provider. What does that mean to our viewers?
And that's an important thing for the viewers to understand. Non-hospital is clearly what it states, but outpatient is the tricky thing. Outpatient services in healthcare give you a much more affordable price. Now, the difference is there's a lot of hospitals that own outpatient imaging facilities.
Right.
So it's important for consumers to ask if the outpatient facility they're going to is indeed owned by a hospital. If it is, they will be exposed to severely higher cost. True outpatient imaging is much more affordable than a hospital-owned facility.
Well, how are you able to offer that better pricing then?
Well, we specialize in just MRI and CT. That's all we do. So we can focus in that and drive the cost down on the delivery system, whereas hospitals, as we all know,
Right.
is a much bigger animal and obviously more cost associated with that.
Of course. And then tell us, because I know we want to also talk about just its high quality services that you provide. So talk to us of what differentiates you.
Well, to talk to the cost too, I think the other piece you got to remember is that there's a lot of additional costs that come that you don't often hear about until after the bill comes.
Exactly.
So, lease or facility fees, and then you get the radiologist fees and things like that. Additionally, when it comes to the quality piece, we've got the same equipment that you're going to find in the hospitals. We've got the same radiologists that are often reading in the hospitals. Mm-hmm. They're all board certified, accredited, subspecialized radiologist. And so you're getting the same level of care,
Sure.
just in an outpatient center where you're spending quite a bit less.
Right. And let's go back to the radiologist qualifications. Mm-hmm. I'm sure, just as you would find in a hospital.
Absolutely. In fact, many of the radiologists that do interpretations for our company also do interpretations for the hospital. So when you're looking at a hospital versus an outpatient center, we really use the same exact scanners and oftentimes read by the same exact physicians. It's just an outpatient setting with far less cost associated.
Right. And we're seeing there, of course, they have the physician on site. Studies read within a 24-hour turnaround, which is incredible. That doesn't always happen with traditional standards of care.
No, that's very fast, but truthfully, it's much shorter than that these days due to the advent of PACS systems. So we do the scan, and then our images are sent electronically within minutes to the physician that referred the individual,
Sure.
but also to the radiologist that's going to read it. So we can have it really in 30 minutes, quite honestly.
How incredible. And what is this global billing?
Well, so as I mentioned previously, we bill, it's one fee, that's it. In the hospitals, you're going to get the professional and the technical broken up, and then also you've got some of the additional charges that I mentioned previously. We do our best before somebody comes in to verify their benefits,
Right.
give them a very good estimate of what they can expect the charges to be, and at that point, there should be no surprises on the back end.
Sure. Well, I think at the end of the day, it's on us as well to do our homework, to make that initial phone call, just so we feel like we're armed with all the right knowledge we need. I know sometimes with anything dealing with medical care, you can feel overwhelmed, but pick up the phone, call, and just find out more information, right?
And, I want to point out also, with regards to the cost, our cost in an outpatient setting is going to be around $500 to $600. A hospital setting is somewhere between $2,000 and $3,000.
Right.
And it's all about the contracted rate that the provider, us or a hospital, has with the payer, an insurance company.
Sure.
So if a hospital has a contracted rate of $2,000, you're going to pay, if you have a high deductible, potentially that whole $2,000.
Exactly. Right.
Or if you have 20%, you're going to pay 20% of that deductible. In our facility, it's $500 or $600, and so do the math. 20% of that is far less.
Right.
Or if you're high deductible, $500 or $600 is far less than the $2,000.
Right.
Big difference.
Absolutely, a great solution. And where can we find you?
So we are throughout Metro Atlanta. We have centers outside of Atlanta, but most of our stuff is in Atlanta. We have Decatur, Lawrenceville, Canton, Fayetteville, Noonan, West Cobb. We're adding 3 or 4 additional facilities here in the next month or so. So we're excited about that. But, in the last year or so, a lot of the hospitals have bought up outpatient imaging centers. Mm-hmm. We are really the last remaining freestanding, non-hospital affiliated outpatient imaging facility. And that is a huge, huge difference. And
Right.
hopefully people or your viewers will understand that, because it is a big, big difference.
Right. A dear friend of mine, funny you should say that, worked at one in Duluth, and she just was bought out by one of the larger hospitals here very recently. So, right. So,
It's the big trend these days.
Right.
Hospitals are buying up everyone.
all right. So just make sure you schedule an appointment now. It's American Health Imaging, and very easy. Just call or go to the website to schedule.
Yep.
You can go to 1-855-MRI Choice. You can visit us at the www.americanhealthimaging.com. And again, you can always remember you have a choice. So
Yes.
you get the referral, and at that point, it's up to you to figure out, do I need to go to the hospital just because I was
Right.
referred there? The care's really in your hand at that point.
Right. Thank you so much. Great information. We appreciate you being here.
Well, thank you for having us.
Of course. And if you would like to contact American Health Imaging, please give them a call. It's 1-855-MRI-CHOICE, or log on to AmericanHealthImaging.com. And this segment was paid for by American Health Imaging. Thank you.